Hello, I'm Susanna Hopsalarin, Senior Editor with Hospitals and Health Networks magazine. I'm reporting from HIMSS, and today I have with me Debbie Gash, Vice President and CIO at St. Luke's Health System. We're going to talk about physician quality reporting. Hi, Debbie.
How are you?
Fine. You know, Debbie, what are the new requirements?
Well, there is currently CMS is converging its regulations related to meaningful use, quality reporting, value-based modifier under this new MACRA legislation. So there is a lot of moving parts, a lot of new information that's coming out. So we're trying to bring some awareness of what these regulations are and the impact that it might have to both physicians and hospital organizations.
How is St. Luke's changing its approach?
What we have done is really learned as much as we could about the regulations and focused on setting up a governance structure that would allow us to react to and comply with these new regulations. And that governance structure is really a multidisciplinary team of both physicians, our quality department, as well as people involved in physician operations.
Are there penalties and incentives that hospitals and health systems should be aware of with these new physician quality reporting requirements?
There are reporting requirements, and if you fail to report, there is a 2% penalty to your physician reimbursement. If you perform poorly and your quality metrics are low, then you could also see a disincentive of another 2% in your physician reimbursement. So certainly penalties upwards of 4%, and those penalties are continuing to grow over time. And then in addition to that, there is the meaningful use penalties that are pending. And since CMS is starting to bring together these regulations, the penalties are just compiling, and over time it could be upwards of 6% of reimbursement.
What advice do you have to hospitals and health systems on how they should prepare for these new physician reporting requirements?
I think they should be as familiar as possible with the regulations and ensure they understand the impact it has on their organization. And I think trying to establish that governance structure that St. Luke's has been working on would help them be more successful in meeting these requirements.
Thank you, Debbie.
Thank you.
Susanna Hopsalarin for H&HN.